We might have taken the one-on-one interaction for granted, but this indicates how important it is for students to interact.
A new survey from CAMH shows the pandemic has taken a major toll on Ontario students' mental health. More than 2,000 students from grades 7 to 12 were polled. 59% reported feeling depressed about the future because of COVID-19. 39% say COVID-19 has negatively affected their mental health. 26% say it was very or extremely difficult to learn online from home, while 24% say their relationship with their parents has become worse. So here's our panel now. Joining us live tonight is youth psychiatrist Dr. Amy Gajaria, along with 17-year-old Mississauga High School student Russ Levy. Russ, the pandemic, of course, has been isolating for all of us. Talk to us from a student's perspective. What's been the hardest part of the past few years and the toll it's taken on you and your friends?
Absolutely. I think that probably the hardest part about it has just been the sheer amount of isolation and kind of how separated everything feels from everyone else. It's kind of like watching everything from a distance, even when you're living through it. It's kind of exhausting, kind of an overwhelming feeling of dread, at least from back then as it's gotten better. It kind of lessened, but it kind of still remains.
Okay, I have a little bit of problems with your signal right there, but Dr. Gajaria, how do adults help here? Not just parents per se, but also aunts, uncles, cousins. Teens and kids have had their own set of challenges through this pandemic. Not something I have lived through, but I want to help. So what's your advice?
I think it's always great to talk about what's been going on. This has been such a hard time for young people. It's been a hard time for all of us. And so I think helping young people talk about what their feelings are, how they've been doing, validating them, that means telling them that you understand what's going on with them, and then helping them find ways that are safe to reconnect back with the people they care about. So structure in their day, being outside, activity, finding meaning, all of that really helps people when they're struggling with such a hard experience.
Of course, typically going to school physically has been that structure, but of course that's been lost. Dr. Gajaria, social media and cyberbullying are, of course, a growing problem. It's not just a case of limiting screen time anymore. What can be done to support students in a better way so that they feel safe and comforted at home if they're being bullied online?
Cyberbullying is such a difficult thing for young people. It follows you everywhere. So the challenge is when all of your media is on a device, you don't get a time to like kind of turn off or not have to have it follow you. So time without your device is amazing, both for young people and for adults. So I always say to parents, model what you want your kid to do. So if you expect no phones at the dinner table for an hour for everyone's well-being, everybody turns their phone off at the dinner table. You practice that together as a family. You put your phones off, you have your notifications off, so that young people aren't followed by that all the time and they get some relief from it. So it doesn't feel like it's constantly hanging over their head.
So Russ, here I am showing my age. I didn't grow up in high school with the access to a cell phone that easily. What's it like in class, obviously, before the pandemic and slowly getting back to that. But right now, when everyone has access to a tablet, to a phone, what is the personal experience of cyberbullying for a teenager?
For me, I think I've been lucky in that I haven't really experienced that, but just with the sheer prevalence of social media and everyone else kind of being online all the time, it gets really exhausting. So even when it isn't cyberbullying, there's still kind of that level of pressure, I think, that everyone kind of has to deal with in making sure that your online presence is ideal and like kind of perfect in a way, and it gets kind of tiring. So although I haven't experienced cyberbullying,
Right.
I know for myself it's kind of tiring having to kind of live up to those kind of expectations, I guess.
Yeah, a lot of pressure to always keep up when you are always connected. Now, here's a question never asked before in the CAMH survey, and Russ, this is back to you again. Feelings about climate change in your future. Half of respondents say fears for the future of the planet are making them feel depressed. From your perspective, at around what age do you think you and your peers started to worry about the future of the planet?
Absolutely. I think it's one of those things that makes me, at least, and my friends kind of feel like we're responsible for something that we didn't do. You know, with kind of how the way the earth is kind of going, at least in the kind of negative direction and trend that it's in. It's hard to handle, I guess, the responsibility that we're inheriting as we get older. It's one of those things where we're going to go into a new generation where we're now responsible for kind of, I guess, saving the earth in a really, really broad sense. And that's really scary. And it's hard to like imagine a future as an adult that's so uncertain.
Right, of course, a problem that you didn't create, but now that you're tasked with coming up with a solution. Now, Dr. Gajaria, for older people who've never been asked this question on a survey before, how do you approach this topic with kids and teens?
I think what we hear from both pieces of this survey, both the effects of COVID and this question on climate change, tells us that young people are really dialed into the world around them, and the world around them is affecting their mental health. And so we may not always think of that. We think of youth as really being within their environment, in their school, that being their life. But really, we can see the world around them really affects them, and it's really affecting their day-to-day lives and things they worry about all the time. And that's something I hear from my patients spontaneously all the time when there's difficult things happening in the world.
All right, so definitely a lot of support there. So Russ, with this survey, what do you hope people take away from it?
That young people are trying, but we need more support. There's not enough available for young people right now in order to succeed as best as they can. We're coming back from such a massive event, and we're kind of trying to go on as normal when it's still not normal. So I guess making sure that we're supporting young people as best as possible and making sure that we're there for them as best as we can be.
And Dr. Gajaria, you obviously have a lot of experience in this. Should this report be a call to action, just more proof that our young people, as Russ is saying, are really dialed into what's going on and need our help now more than ever?
Absolutely. We've been in a youth mental health crisis before the pandemic. The pandemic only worsened things. We absolutely need more services, more resources for our young people with respect to their mental health. It's one of the most important things I think we need at this time.
All right, Russ Levy and Dr. Amy Gajaria, thanks so much for your insight. We really appreciate it tonight.
Thank you for your time.